Got it, sir.
I gave it, yes, now it
Yes.
has come. See, what did I study? I studied that. See, why I don't like to use any other prefix, suffix about me, because it blocks my mind. We people in medical science spend how much time in reading papers, Ronnie? Instead of asking you questions, why he did not go to study in scholar.google.com? Hmm?
I think they are not aware. They don't know about
Then
this.
see, the question is not about awareness. Question is about learning. Question is about the culture they have in their mind.
Right,
For
right.
example, for example, if I get anything new, any new word also new, where do I found out? First, I study it in Google, and then I go to scholar.google.com and I read what are the things referred to this material. So when I came to know glucose has so fundamental properties, I said, why don't we try with spasticity, because it can dissolve tumors. Many types of tumor, benign tumor and all, especially motor neuroma, which is because of the sleepers. So it can recover that tumor within 2 or 3 minutes. Now, why not spasticity? I studied the properties of spasticity. I have studied the properties of Botox. I studied this property. Now I realized, oh, it is very good.
So are you able to give me some reference on this of your paper?
Yeah, it is already there, just like PNIT. I already took a class on that. All the papers I have given. That control trial was made with dextrose injection and Botox. I took a class on that. Complete class was taken.
I see. I think I missed that one.
Because I took 3 classes on that. How to use the dextrose injection and the control trial with painkillers and different control trials in different parts of the world. From 1986, it has been used in America, but no one used it in spasticity. They used it in injection therapy for pain and the, what do you call, reflex points, right? They were, because the nerve was too excited to calm down the nerve, they used it up to now. But I was the first one to use it in many types of what? It as a nerve block. I used it as a spasticity. I used it in recovery of paralysis by inserting ear in the scalp. I was the first one to do all these activities. But then our problem is what? We are too clinical. Even now I have thought of becoming what? This pandemic has made me a little bit academic. Otherwise, I have no time. You see, I was a person who used to do 240 to 250 OTs. You see 8 patients a day and I do 8 OTs a day. Forget about my OPDs and all. Now you see what is my time. 70 OPD in a month. How much we have come to the down. I'm the same person who used to do 240 to 300 OTs a month. And I'm the same person whose OPD is how much? 70. My OPD was how much? 800 patients a month. Now how much? It has reduced to 70 because of this pandemic. 70, 80, 100. That's it. So, what did we understand from this? Nothing is permanent in this world. And the most important part of every physician is, that is why I say, you people say me so many things. But then I say, you see, what is our culture? I laugh at those people. They call themselves medical doctors. I say, oh, so outdated medical doctors we have in this world. Thank God I am not their patient. Others, they would have prescribed me Botox instead of, they would have made my bill of 10,000 Singaporean dollars instead of making it 5 Singaporean dollars.
Mhm. Yeah.
You can imagine, after 50 years of their practice also, they are outdated.
Yes. Their mind is just too restricted,
Yeah, because they don't spend time in scholar.google.com. They don't study the research papers. They don't study the advances. And we always do this type of trials in our own clinic. We do these trials with Tung Acupuncture. We do these trials with a lot of things.
Because in Singapore, it's not so easy just to do trial.
No, trial means what? You are comparing in your own clinic. No one stopped me from practicing my acupuncture. No one stopped me from doing this because I'm a physician. So when I have the consent of the patient, I said I'm going to use and I explained the patient I'm going to do this, and the patient allowed me to do it. And when I do, I compare in comparison with an NIBS, and then I compare with SNIT injections. So I gave it my name, Sasty Neural Injection Therapy. In other course, it is PNIT, but then when I used it for spasticity and certain other process, no one did it before. So I called it SNIT, Sasty Neural Injection Therapy.
Very good.
Since I did not do write papers and publish papers because we don't get time. Now we are getting time, right?
Yes.
For 20 years, we did not get time. I told you we did not see the sunlight for 20 years in our life. You can understand how busy I was. On the death of my father, I collected his dead body, I cremated him, and then I back to ICU. I did not even go and talk to the people.
Understand.
So now what you can understand, how much busy we have. So this is what I was saying. The approach of a physician is different from the approach of a society. So the people whom you spoke, what you called Ronnie, they are
Yes.
they are not medical doctors. They are they're just running their family out of their practice, because if the patient comes, they want to just see what are the medicines available, just prescribe the medicine. If the patient does not recover, put the higher medicine. That's it.
Yeah.
Do the lab test, put the medicine. This is what they know. That's it. They don't even know about micronutrients. Ask them what is micronutrients.
Yeah, they say not scientific, not proven.
No. Ask them what is micronutrients.
They don't use that.
Yes.
They don't
They don't
believe.
use the hormones.
Yeah.
No. Their belief or our belief will not work in medical science. This is what I am saying. See, being a medical doctor, you believe something or you don't believe something, is not going to hamper the medical science. Medical science is pure and perfect. So,
They cannot
if they don't know
recommend
anything, it is their
vitamin and all
problem.
that.
Yeah, if they don't know anything, it is their problem.
Yes.
On the other side, you see a Rashmi knows, I know, many Sudha knows. They are also medical doctors.
Yes.
Kiran Kumar also knows. So all these people they know. So who is better?
No, because at the end of the day, it's also the ministry, The
See, ministry in one thing I tell you.
and all those
No,
people.
no. One thing I tell you. No ministry in the world stops a medical doctor to prescribe some good vitamins. No medical doctor in the world, ministry, stops them from prescribing some neurotransmitters, hormones. It comes in the periphery. A ministry may stop you, but the medical doctor cannot be stopped because it comes in its periphery.
No, I'm referring to vitamins and all those things.
Yeah, vitamins are prescribed by all the doctors.
They don't really.
If a doctor does not know how to prescribe a vitamin and nutritional medicine, that means what? It's not a doctor.
No, they do, but that's why sometimes I ask, hey, doctor, is this vitamin good for this? They don't want to say yes or no.
Yeah, because they know that, see, the problem with medical doctors are that some medical doctors, they have earned their degree and they're stable to their knowledge. But on the other side, if you see some medical doctors are in our group also, at the age of 60 years or 70 years, they are still studying.
Yes.
They are not feeling ashamed of coming in a non-medical class and studying it.
Yeah.
They are also medical doctors. So question is not that medical doctor does not mean you are in a higher position.
Yeah. So this is the feedback I have. So just to let you know.
It's okay. We are
Yeah.
not afraid of their feedbacks because the
I know.
question
I
is that
know.
we
That's
know
why
their.
what I mean. Sometimes they are just very narrow-minded.
No, we don't call them narrow-minded. See, Ronnie, can you hear me before I
Yes.
come to the
Yes.
top? See, we don't call these doctors as narrow-minded, or no one is narrow-minded. The question is that they are simply they don't have interest in study because they see how will they get interest? They see 20 patients in a day. It is enough. Their children are grown up.
Yeah.
So they are worried about making money right now from the clinic. They have to pay the money. They have to pay the EMIs. They have to pay the salaries.
Mm.
They are already stressed up.
Yes.
So where will they study? They are saying if he recovers, okay. If he does not recover, let him go to other doctor. I can't help.
Yeah.
And we say that they have come after visiting all the doctors. It is my duty to recover him. Where will he go?
Mm.
So there are two
Yes.
approaches. One approach is to recover the patient. Other approach is what?
Just to manage the
Yes, just to
symptom.
manage. Yes. Because the patient who comes to us, they offer only how much X-ray? They offer an X-ray of only 4 Singaporean dollars, right? And this is the maximum investigation we can write to them. Our maximum investigation cannot be more than 10 Singaporean dollars. In Indian currency, we call it 500 rupee. In 500 rupee, we have to give a diagnosis to the patient. That means what? Our clinical knowledge should be very, very perfect. We must be able to rule out whether he's suffering from cancer or not. Just 500 rupees. And this is only possible because of our clinical knowledge.
Yes.
And that is why I say all of you. See, the problem with us is that we did not study properly. Now study properly and upgrade your knowledge. That is why I included all the best subjects, dermatology, I included cardiology, I included how to study ECGs, how to understand when to write this type of, what is cardiac stenosis, what is this. At least, if you cannot write an investigation, that does not mean you should not read an investigation. So when you cannot write an MRI, it's okay. But when the patient brings an MRI, you must be able to read that MRI. You must be able to understand that MRI. And what are the harms it will happen to the patient, that you must know. So this is the problem of ours. We are still 2 years back, 10 years back, 20 years back. I don't know. Anyway, hardly matters. Harman, are you there?
Thank you. Thank you.
Sorry, I took some time for explaining this. Harman, are you there?
Yes,
Harman?
I'm here. Yes, I'm here.
Arvind, Malaysia, are you there? Arvind, are you there from Malaysia? Arvind? I think it's not there. So, see, what do you, let me see whether one sister is there from what you called mm, from Thailand. Are you there? Sister, are you there from Thailand? Sister from Thailand, are you there? Sister from Thailand, are you there? So before we go to Tung Acupuncture, what are your doubts in Tung Acupuncture? Many people have said this. Many questions have come to me. So I want to know, what are your doubts so that I can clear it? Anyone is having any doubt?
No. Hello.
You don't have a doubt. Others should have it.
Hello.
Yeah, tell me.
I am from Kerala.
Tell me.
I would like to explain about the 5-element theory.
See, 5-element is not in Lingu Dabai. I'm not teaching 5-element here. I'm saying Tung Acupuncture. 5-element is not here. I'm not taking an acupuncture course out here. TCM course.
TCM course.
I'm not teaching TCM here. Right?
Okay. Right. Thanks.
So relieving spasticity using tongue acupuncture.
So relieving is tongue acupuncture cannot recover spasticity. Spasticity can be either recovered by NIBS, Botox, or SNIT injection.
Sir.
There are only 3 solutions for spasticity.
Sir.
Tell me.
Hello. Sir. There are
tell
many
me.
systems in world. One of them Sujok and reflexology, acupressure. But
Tell me.
in that full system, we will treat in foot and hand. But we will treat in foot and hand. But that points are different.
What do you want to ask?
In Sujok correspondent points, hard point is in.
I'm not asking Sujok. What is your question? You have to ask a short question. You cannot explain me this Sujok. This is not a Sujok class. It's not a 5-element class.
Okay.
I'm asking you what is your question.
The points systems are treated in hand and foot, but the points are different. What is the reason?
Treated our points are different. See, entire mechanism. So, for example, if you ask me, so what is the difference between homeopathy and Ayurveda? They have their own system of treatment. Sujok has his own mechanism of treatment. I don't know anything about Sujok. But so far I know they insert they said they tonify certain things. According to me, Sujok has his own pathology. I don't understand it. I don't want to comment it because according to me, I am a physician and we treat critical problems. There may be good results in this system. I don't deny it. But then it has its own mechanism to work and it has nothing to do with Tung Acupuncture. So I'm asking any question relevant to Tung Acupuncture. I'm not asking anything from TCM. I'm not asking anything from this. I'm not asking you from 5 elements. I'm asking something from Tung Acupuncture. Any more questions?
Sir, before going to start treating spasticity, is it mandatory to test by spasticity by any means of MAS or geometric?
They are all. See, all there are very standard procedures of testing the spasticity.
Ashworth scale or geometric?
No. See, there are very standard procedures for treating what? Spasticity.
Spasticity.
Yes. There are clinical tests, investigations, DTRs. Who is Suliam? SULAIM.
I am.
You should switch off your mic after questioning. And what is your qualification, Suliam? Suliam? Suliam, what is your qualification?
Acupuncturist.
Huh?
I am an acupuncturist from Kerala.
No. What is your qualification? I'm not asking your profession. I'm asking your qualifications.
+2.
+2.
+2.
Suliam, I'm sorry. You have entered this course at a very long time later period, right? So for now, we cannot allow you to continue in this course.
Hello, good evening, Doc MK.
Yes, please tell me before I go to.
Just want to ask if we cannot invite more new ones now.
You can
If they-
invite. See, you can invite. This person was just a 10 + 2 is a high school, just a high school graduate, right? It
Yeah.
doesn't. It does not understand the various pathomechanism of treating a disease, right?
Okay. Because
So
I
when he
am
does not,
inviting.
no, you can invite people. The question about this fellow is that he knows nothing about medical science. How can he thinks Tung Acupuncture and Suzuki say?
Okay, because I have 2 new invitees from
No,
US.
you can, no. You can see anyone can invite any people. This class is open to all. But if
Okay.
some people who has a below IQ level, how can we entertain them?
Yeah, okay. I understand, Doc. Thank you so much.
See, question is that you can understand something, right? When I speak about disc, when I speak about nerve. Now, if I ask him what is the difference between nerve and the artery, what will he say?
Okay.
So if you if you teach this type of people and if you give diplomas to this type of people, what will happen?
Okay, Doc. I understand now. Thank you.
Yeah. So I don't want to do anything wrong to the society. I'm not a greedy man. Harman, are you there? Oh.
Yes, I'm here.
What was the last point I discussed yesterday?
Last one. Okay, you
Fights and 6. What did I discuss yesterday? Which are the 3 points I gave? Open your notes.
okay. Yeah, yesterday about PIVD. The last one is L4, L5 disc extrusion, shoulder
Yes, correct.
migration, nerve impingement, tingling sensation.
Yes, SLRT 30 degree, was scale pen 10/10. Correct.
Yes. But that one is for doctor.
Your screen is
No.
not showing the slides.
No?
Not yet, sir.
Again, I shared it.
It's right now, sir.
You can see?
Yes, sir.
Walid, can you see?
Yes, sir. I can see it now, sir. 22.04. Dabai.
Yeah.
Mm.
Yes, right. L5S1. Dua-dua empat. Dua-dua enam. Dua-dua lima. So it is dua-dua empat, dua-dua lima, dua-dua enam. That is 22.04, 22.05, 22.06.
Okay.
Air question, sir.
Dua-dua empat, dua-dua lima, dua-dua
6.
enam. Yes. 22.04, 22.05, 22.06. Right?
Yes.
Opposite side kidney 3, spleen 9, spleen 6.
SP9 6, SP9, SP6.
Spleen 9, spleen 6.
Okay.
Correct? So you can
Yes.
check these points where in the Google also, in the YouTube also. Just write the name of the points. You can see how to insert needle and where is the location of these points. Very well maintained in YouTube, very well maintained in Google. Just write SPA6 acupoint. Right?
Yes. This one is spelled
After putting
alpha.
the needle, yeah.
Yes.
Yeah, after putting this point, if the pain is high, what will you do? You have to put one blanket on the patient so the sweating starts.
Oh.
Once the sweating takes place, it should take place in 2 hours. Means the sweating will come out. Once the complete sweat comes out, put off the blanket.
Okay.
Then again let the sweating come up. So it will take 4 hours. Once the 4-hour procedure is over, ask the patient to continue electrolytes.
Electrolyte.
Yeah,
Drink.
electrolyte powder. Yeah, you have to continue electrolytes so that during the process it does not go dehydrated. Insert the point. BL 29 3 10 3 blast na 31 is 3 blast na 3 1. What it is? 3 blast
31 or 13?
31
31 31.
31, yes. So BL 31, BL 32, BL 29 and BL 30.
Okay.
What are the points?
BL 29, BL 30, 31, and 32.
With gallbladder 30.
Okay. KB 30.
31. GB 30. Yes, GB 30. Stimulate these points with the help of the pain. Then put the blanket. The pain will subside by 80%. And medical doctors can follow the procedure of yesterday. L4, L5, L5S1, same procedure. Those who are medical doctors, I have taught them yesterday one procedure. I think it's a very good procedure. Patient can recover. For frozen shoulder, write down.
Frozen shoulder.
Yeah. Acute pain in periarthritis. Now, Herman, can you tell me what is periarthritis?
What? How to
Periarthritis of the shoulder joint.
Frozen shoulder?
Periarthritis of the shoulder joint. What do you mean by this?
Painful around the joint.
I'm asking periarthritis means what? I'm not asking you the symptoms of periarthritis. I'm asking you what is periarthritis. Of the shoulder joint.
Calcium crystal disease because calcium.
Okay, anyone else?
Stiffness and pain in the shoulder joint.
This is a symptom.
Unable to move or raise or rotate the shoulder joint. Or with restricted movement.
What is periarthritis of the shoulder joint?
Inflammation of the structure around the joint.
Periarthritis means stiffness and pain in the shoulder joint.
Frozen shoulder, sir.
Then okay, what do you mean by bursitis?
Periarthritis means stiffness in
Inflammation
the
of the
appendix.
bursa, sir.
Huh?
Inflammation of the bursa. Bursitis. Inflammation of the. And flaring up of the joint is periarthritis.
Any more?
Frozen shoulder is a complete lock of the joints. It is a frozen stage, and it has 3 phases: thawing phase, recovery phase, acute phase.
So now you can understand. Frozen shoulder and periarthritis is different.
Yes, different. One is inflammation, one is stiffness.
Yes. So one thing I want to ask you. If you do not know these things, how will you recover a patient?
Sir Sastre, this is
Yes,
Carlos
tell me.
Ibanez.
Yes,
It's
tell
a
me.
calcium crystal disease, sir. Actually, calcium.
Do you believe?
Crystal of the mineral calcium rubbing
Wait,
against
one
the
minute,
soft
one
tissues.
minute. Periarthritis means what? Is it a calcium deposition? Sunil?
In the joints.
No, sir. No, sir. No, sir. That is the difference, sir.
It is inflammation around the joint.
Calcified tendinitis also, there is a different thing, sir. It is nowhere related with the periarthritis.
Yes.
Swelling around the joints.
Periarthritis is inflammation around the joint.
Periarthritis means painful joints.
Huh?
Periarthritis means painful joints. Do you believe that? What is the two causes of
Peri means
periarthritis?
peripheral joint. That's all.
Huh?
The periarthritis, the frozen shoulder mostly occurs in diabetes, but periarthritis without diabetes also it may occur. There are so many things which will relate to the shoulder pain. It may be shoulder cuff tendinitis, bicipital tendinitis, supraspinatus tendinitis, infraspinatus tendinitis. Calcification of the tendons is deposition of calcification on the tendons. It is a different thing. Frozen shoulder, more than 90 degrees you cannot do, then it's a problem of frozen shoulder. Another problem is the glenohumeral rhythm. Until 120 There will be no pain. 120 to 160 pain will be there. 180 again it won't be there. So different things are there in that. Shoulder bursite is the inflammation of the bursa. Inflammation is flaring up. That is dolor, rubor, redness, tenderness. All these 6 pieces will be there in the inflammation of the joint. On movement, tenderness will be there. Then stiffness will be there. Increase in temperature will be there. So all are different things. Sometimes deltoid palsy also will mimic this condition. Actually, it is called as adhesive capsulitis.
Now I want to know. You see, now you can see there is another symptom called subacromial pain syndrome. You know, humeral instability, and there are certain called acromicoclavicular joint, entrapment, myofascial, fibromyalgia. So how many conditions? Entrapment. So now you see, I took my class in frozen shoulder and everything. How many people wrote notes? So, what will you do today, huh? You don't know about frozen shoulder. And we are writing the treatment of what? Very poor status. You people never go in the home and then you see. So write down the causes of shoulder pain first. So what are the 3 main bones? So what are the bones of the shoulder joint? What are the bones?
Glenoid cavity, acromion process, humerus head, sir.
Yeah, but then you know it. What about others? So we will make it a very simple thing. We'll make it the humerus, the clavicle, and the scapula. Correct?
Yes, sir.
Yes.
So now write, rotator cuff is made up of 4 tendons. Rotator cuff is made up of how many tendons?
4.
Yes. Tendons are the tissues that connect muscles to bone. Write down. You do not know what is tendons, people. Write down the definition of tendon. Tendon are the tissues that connect tissues to muscles to bone. Right? The causes. You don't switch. You people should switch off your mobile. You are putting song. You are putting everything. So please dictate them. Sunil?
Sir.
Dictate one by one. What are the definitions slowly? Shoulder impingement syndrome. Dictate them. What is the meaning of that?
Shoulder impingement syndrome.
Write down everybody. Shoulder impingement syndrome. Dash. Define them. What is the definition?
In the shoulder joint, any bone or any other structure like tissue gets
Very
impinged, gets pressed by the bone, then it is called as shoulder impingement syndrome.
Yeah, slowly. Yes.
Yeah.
Again, please.
Repeat it.
In the shoulder joint, any tissue, any ligament, or any connected part which is pressed by.
One minute. Stop. Let them complete the sentence.
Okay, sir.
It is not Rajdhani. It is passenger train.
Okay, sir.
Have you written down? Harman?
Yes, okay. Any tissue or ligament.
Yeah. Pressed by the surrounding.
Pressed by the surrounding.
Bony structures.
Pressed by the surrounding. Written down, pressed by the surrounding. Oblique. Bony structure. Yes. Then
it is called as
shoulder impingement syndrome.
Shoulder impingement syndrome.
Yes. What are the main symptoms?
Pain.
Yes.
On pressing the point, that is tender zones.
Pain pressing the point.
Where it is very tender.
Okay.
This is one. Pain while movement.
Pain while movement. Okay.
Movement. Then little increase in temperature.
Pain if there is increasing temperature.
That is third thing. Second thing is pain while movement.
Okay, already.
Third.
The third.
Yeah.
Yeah.
Little increase in temperature.
Yes.
Yeah. Pain of
pain
in sleeping process, in the pain in the sleep.
Yeah, while you're in a sleeping posture. While you sleep, there is acute pain in the shoulder joint. Patient will complain of acute pain during sleep.
Sleeping posture. Okay.
Morning stiffness.
Okay.
Morning stiffness means once you get up, awake in the morning, for 10 to 15 minutes, pain will be there in the joint in early morning.
Okay.
For some people, winter season pain will aggravate.
Weather pain is?
For some people, pain
Okay.
will aggravate in in winter season.
Okay. Aggravate in winter season.
Some
Okay.
people get pain by putting hand in the back of the head while sleeping.
Oh, okay.
Lack of mobility in the joint.
Stop. Let him write down.
The last one is what?
Lack of movement in the joint.
Okay. Finish.
Some people will get pain after 90 degrees rise in the arm.
We get pain after 90-degree
rise of shoulder joint.
Rise of shoulder
joint. Yeah.
Okay. Yes. Finish.
Main cause is diabetic.
What?
Diabetes.
Oh, diabetes. Okay.
Post fracture stiffness.
What?
Post fracture stiffness.
Post fracture. Yes.
Post fracture
stiffness.
Fracture.
Stiffness.
Yeah. Post surgical stiffness.
Post
surgical stiffness.
Okay.
Other causes. Rotator cuff tendinitis.
Rotator cuff tendinitis. Tendinitis. Now you define them. What is rotator cuff tendinitis? Rotator cuff tendinitis. RCF.
RCF.
No, RCT. Sorry. Rotator cuff tendinitis is RCT.
Tendinitis.
Yes.
Abbreviation of tendon.
Okay, aggregation of tendon.
Yeah, it is a connective tissue between the muscle and the bone.
Oh, it is connected tissue with
from muscle to bone.
Okay.
Okay. Inflammation of tendon is tendonitis.
Okay.
Okay. Wherever ITIS will join, it is called inflammation to that part. Appendicitis. Inflammation of appendix. Arthritis. Inflammation of the joint. Like that. Wherever ITIS will come, take that granted. It is inflammation of that part. Arthritis, appendicitis, hepatitis, dermatitis, capsulitis, wherever the end part ITIS will come, that is inflammation of that area or zone.
So what did you understand by this, Harman? Whenever there is a inflammation.
Yes.
Then explaining.
Inflammation
Sunil,
to that.
explaining.
Yes, sir. Yes. Wherever inflammation ends to that part, then it is called as inflammation of that area. Example, arthritis, inflammation of the joint. Fasciitis, inflammation of fascia.
Bursitis, inflammation in the bursa.
Bursa or bursa.
Bursa or bursa. In Assam, we call it bursa.
Inflammation of capsule, capsulitis.
Okay, inflammation
Of capsule,
okay.
capsulitis. Inflammation of muscle, myositis.
Okay. Myositis.
Myositis. Rotator cuff consists of 4 muscles.
Can you please repeat the last one, sir? Thank you.
Sunil, repeat him.
Inflammation of capsule is capsulitis.
Inflammation of muscle is musculitis.
Inflammation of muscle is myositis.
Myositis, myositis, not musculitis.
Myositis. Okay.
Myo is called as muscle.
Rotated calf.
Myo is
One
called
minute.
M.
1 minute. Myo is called as muscles, right?
Yes, sir.
Wait, wait. Others completed? Krazia completed?
Sir.
Krazia completed?
Yes, sir.
Yes. Write down. Next, Sunil.
Rotator cuff tendons is composed of 3 muscles.
Done.
Supraspinatus,
Yeah. Supra.
spinatus,
Okay.
infraspinatus,
Spinatus.
teres minor.
Huh? Iris.
Teres minor.
Teres minor.
Oh, Paris minor.
Not Paris, Teres.
Teres.
Yes, we call Paris Indonesia. Paris minor.
But Paris. In English, it is called teres minor, means teres minor. Don't write Indonesian Bhasa right now.
Okay, okay.
These 3 muscles.
Sunil?
Sir.
Finish.
Continue.
These 3 muscles.
Yes.
Consists of 3 tendons. One is supraspinatus tendon.
Okay.
Infraspinatus tendon.
Okay.
Teres minor tendon. All these three tendons get inflamed. It is called rotator cuff tendinitis.
Okay.
Okay. Main causes: lack of exercise, lack of circulation, lack of elasticity in the tissue, which causes stiffness in surrounding muscles, ligaments, tendons.
Can you repeat? Thank you.
Yeah.
So I'll repeat it.
Yeah. Pain at that area, lack of elasticity in the muscle, lack of proper circulation.
No, slowly. You have to allow them to write.
Okay. After writing, tell them to tell over, sir. Then I will.
You give them to say one sentence. Give 30 seconds to 40 seconds gap.
Okay.
Say your sentence.
Yeah. Lack of elasticity in muscle.
Yeah. So lack of elasticity. Then stop.
In muscle. Yeah.
Lack of elasticity over
in muscle.
In muscles. Now stop. For 30 seconds, 40 seconds. Give a go.
Okay.
Everyone written? Lack of elasticity in muscles.
Yes, done.
Done.
Lack
Next.
of movement.
Lack of
movement. Over.
Lack of moment or movement?
Movement.
Moment. Not
Movement.
Movement.
Movement is something is in the life. It is English. What a beautiful moment we are having right now. It is called movement. And movement means movement, moving your muscles.
But it's movement.
It is not it is movement is not the movement. MOM.
It is MOVEMENT, not MOMENT.
Yeah.
Instability of joint
Instability of joint.
due to muscle weakness.
Muscle weakness.
Lack of exercise to shoulder muscles.
Lack of exercise to shoulder muscle.
Yeah.
Okay, done.
Other tendons involved mostly in shoulder joint.
Okay.
That is bicipital tendonitis.
Bicipital tendonitis.
Please repeat the whole sentence again. Thank you.
Bicipital
Inflammation of bicipital
inflammation
tendonitis.
of
Bicipital tendons. Two types of tendons are involved.
One minute. Inflammation in the bicipital tendon is called bicipital tendonitis. Clear? Written down.
Two tendons get involved in bicipital tendon. That is long head of biceps tendon,
Again.
two types of tendons are involved. One is long head of biceps. One is long head of biceps. Short head of biceps. One is long head of biceps. Short head of biceps.
Can I have a question?
Yeah, Ken.
Yes.
Okay. Previously you mentioned that rotator cuff tendons has 4 muscles involved, but you didn't mention the fourth one. Can you mention it right now? Thank you.
Three only, no? Three tendons. One is supraspinous disc. One is supraspinatus.
Yes, but you mentioned it involves 4 muscles, correct?
That is one other. That is one other thing. That
1 minute. You can also write the normal anatomy of the rotator cuff muscle consists of 4 muscle tendons.
Yes.
One is supraspinatus.
Yes.
Right?
Yes.
Infraspinatus.
Yes.
Teres minor.
Teres minor. Subscapularis.
And subscapularis.
Thank you.
Over?
Yeah. 4 muscles will get involved. 3 muscles also get involved. 2 types are there. SSIT, SIT. SSIT, one subscapularis muscle will be more. SIT, subscapularis won't be there. SSIT, SIT.
Okay, thank you.
Signs and symptoms. Pain around the shoulder joint. Radiating pain from shoulder to elbow. Pain in shoulder joint. Radiating pain from shoulder joint to elbow. Pain while abduction.
Please repeat, sir. Pain by
Pain while abduction. ABDUCTION. Pain while lifting objects. Nodules formation. NODULES. Nodules formation in myofascia. Myo is muscle, fascia is connective tissue. Pain while rotating arm. Pain in trapezius.
Pain in what, sir?
TRAPEZIUS.
Thank you.
Inflammation of trapezius muscle is called trapezitis.
inflammation of what, sir?
Trapezius. TRAPEZIUS.
It's called what?
Inflammation of trapezius muscle. Inflammation of trapezius is trapezitis. TRAPE ZITIS. Swelling around shoulder joint. Swelling around shoulder joint.
Come again, sir.
Swelling around shoulder joint.
Oh, is that still part of the signs and symptoms?
Yeah.
Okay, thank you.
How to check the tender points?
Sunil, unmute your mic. Sunil, unmute your mic. Sunil, unmute your mic.
Swelling around shoulder joint. Location of tender points in shoulder joint. First one. Tenderness means when you press your thumb where pain is existing, the pain elevated, it is called tenderness. When you press the area of local pain point, as pain increases, it is called tenderness. Tender zones, bicipital groove,
What? Can you repeat? Sorry.
tender zones. Number one, bicipital groove. That is anterior part of shoulder joint.
Sorry, one last. I didn't get that.
Yeah.
Thank you.
Tender point at bicipital groove, anterior part of shoulder joint.
Thank you.
Yeah. Tender point of acromioclavicular joint. Tender zone of acromioclavicular joint.
What is the spelling?
Spelling. Tell them the spelling.
ACRO MIO ACRO MIO clavicular CLA VI CU LAR CLA VI CU LAR.
Thank you.
Tenderness at subdeltoid region. Tenderness at subdeltoid region. Tenderness at acromio ACRO MIO coracoid region CO RA CO ID. Tenderness at posterior shoulder joint. Tenderness at posterior shoulder region. Tenderness at scapular muscles. Tenderness at scapular muscles. Different conditions in shoulder pain. First one, adhesive capsulitis.
Please repeat, sir. Thank you.
Adhesive capsulitis. Periarthritis of shoulder joint.
Sir, please. Heading, sir.
Periarthritis of shoulder joint. Diabetic frozen shoulder. Shoulder bursitis. Shoulder bursitis. Rotator cuff tendinitis. Bicipital tendinitis. Shoulder arthritis. Articular cartilage tear.
Can you repeat? Articular?
Cartilage tear.
Okay, cartilage tear.
Sports injuries. Post fracture stiffness. Post surgical stiffness or post operative stiffness.
Can you repeat the last one? Thank you.
Post operative stiffness or post surgical stiffness. Test involved to diagnose. MRI, ultrasound, MRI, CT scan, ultrasound, X-ray, medication part, for swelling, ceratopeptidase, for swelling, ceratopeptidase, combination, diclofenac ceratopeptidase or acylofenac ceratopeptidase.
These are the anti-inflammatory medicines which we give for the shoulder pain.
Called as non-steroidal anti-inflammatory drugs, NSAIDs.
NSAIDs.
Can you repeat, please?
Non-steroidal. See, generally, see, Sunil, no 1 minute, 1 minute, Sunil. See, generally, this where we give here is some anti-inflammatory drugs, right? So this anti-inflammatory drugs can be given, but it does not solve the situation. So when the pain is acute, we give it. So the treatment part will explain you later on, right? So don't give them the medicine advice, right?
Okay.
Because
Patches,
these
sir.
are non-medicals.
Sir, patches, sir.
These are
Transdermal patches.
non-medicals.
Okay, okay.
No, the treatment part will explain them later on. You just tell them what are the classification of the diseases, right?
Yeah, yeah. Frozen shoulder symptoms.
Excuse me, sir.
Yeah.
Repeat medication part. Thank you.
Yeah.
No. It is anti-inflammatory
not.
medicine. See, it is anti-inflammatory medicine. Not required here because our protocol of treatment is different.
Okay, thank
Right?
you, sir.
Sir, patches they can use, no, sir? Common people also.
See, while advising them about the treatment, we can advise them about patches. Right now, just advise them about the diagnosis of the disease, right?
Okay.
Classification of the disease and diagnosis part, okay?
Yeah. Frozen shoulder. Main complaints.
Difficulty to touch the back.
Difficulty to touch the back. Difficulty to raise the arm. difficulty to touch your back, difficulty to raise the arm,
That is difficulty in external rotation of shoulder joint. Difficulty in rotation, internal rotation of shoulder joint.
difficulty to raise the arm above 90 degrees, cannot comb hair, cannot comb hair. That is difficulty in external rotation of shoulder joint.
Period of recovery.
Period of recovery. Three months to 2 years. Period of recovery. 3 months to 2 years. Any condition which heals within 1 month to 3 months, it is acute phase. Any recovery which happens within 1 to 3 months is acute phase. Any recovery more than 3 months, it is chronic phase. Any recovery more than 3 months is chronic phase. Any recovery more than 3 months, chronic phase.
Chronic phase.
Any recovery which happens more than 3 months is chronic phase. Frozen shoulder has 3 phases. Frozen shoulder has 3 phases.
Frozen shoulder has 3 phases.
One is acute phase, thawing phase, THAW, acute phase. In that, number one, freezing stage. Period is 6 to 9 weeks.
Excuse me.
Yeah.
Sorry, what was the third phase,
Which one?
please?
Which one is the 6 to 9 weeks?
Freezing stage.
Okay, thank you.
Second is thawing stage.
Come again,
Of
sir, please. Thank you.
thawing, THAWING.
Thank you, sir.
More than 6 months.
Four to 6 months. Thawing stage, 4 to 6 months.
Then
Healing stage.
healing stage after 6 months. Healing stage after 6 months.
Surgical procedure. Arthroscopy, debridement. Arthroscopy, debridement. Debridement means cleaning the dead tissue. Debridement means DEBRIDMENT. Cleaning the dead tissue or cleaning the damaged tissue. Resurfacing the articular cartilage. Resurfacing the articular cartilage.
So for today it is enough.
Yes, sir.
Just give the last definition. That's enough.
Yes, enough.
It's 9 o'clock.
Yes.
for today.
Okay, thank you.
Now you see. Anything you are over? What you called, Sunil? Or anything you have to dictate? You are
Can I
over for today?
Sir, can I teach homeopathic medicine?
No, 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 no. No homeopathy is required here.
Okay, okay, sir.
Because that will.
Okay, sir.
So you see this was. Yeah, thank you for so much for the cooperation. So now you see, I did not wanted to take this class. I allowed him to take the class. You know why? Because now you can understand how much you know in shoulder joint. How many problems in the shoulder joint, and you do not know. You don't know how to work with the shoulder joint. Take only one joint and so many problems. And up to now, you only know one thing: frozen shoulder. Imagine how much is the gap between your knowledge and the treatment of the patient. Practically, you do not even know how to recover the patient. For example, now I'll tell you, frozen shoulder takes how many minutes to recover? Less than 10 minutes to 15 minutes to bring 70% recovery. And that I always do. You can see my, what you call, Facebook. People come with them less than very tough joints, they bring it to us. And we manipulate it and then we work with in just 2 days, 70% recovery. Otherwise, it takes 3 months. You see, what is the difference between your thought and our thought? See, until you know the mechanism to recover the patient, how will you recover the patient? I taught you in past, in this 500-hour class, I taught you many things about shoulder joint. And today, if I ask you a single question, no one is able to answer. Rather, we have to repeat everything. Repetition is no problem because this is not a coursework. This is just what? I've converted it to a casual class. Why did I convert it to a casual class? Because I understood your foundation is very, very weak. A building whose foundation is very weak, it will fall down with a blow of air. I don't know how to say, what to say, from where to say and where to end. My topic comes end to here. And then you people write so big sentences. You don't know one single point about shoulder pain. Pathophysiology of one shoulder pain. Forget about other disease. That's what I say you. How will you manage the patient? I have serious doubts about your problems. You cannot manage one shoulder pain. How will you manage cervical radiculopathy and myelopathy? Huh? Anyway, ask your questions. See, most of these conditions, if you ask me, how much time you take to recover? I say 2 or 3 days maximum. Otherwise, if you go for medical view, it takes 3 weeks to 12 weeks to 6 months, 18 weeks, 24 weeks. And for me, how much? 4 to 5 days. What should I say? Now I'll answer you one question. Let us ask Arvind one question. Arvind, Filipino. Filipino Arvind, can you speak to me? Filipino Arvind. Filipino Arvind, can you speak to me? Filipino Arvind, can you speak to me? Okay, my sister is there. I was looking for you. I forgot your name. Sister from Iran who's staying in Thailand, a psychologist. Can you speak to me? What are your doubts?
Yes, sir.
Yeah, please tell me what are your doubts. You told me you have some doubts. Can you please tell me your doubts so that I can clarify your doubts?
I don't get your question, please.
What are your doubts, questions? You said you
Uh-huh.
cannot. You have some
No,
doubts.
there is no doubt here. I understand about today the discussion is about tendons and the parts of the tendons and pain over the shoulders and all this. I understand all. There is no doubt.
What is your problem in the tongue acupuncture? Tongue acupuncture? Do you know any? You have any doubt?
Before because I'm professional in psychology, not in acupuncture. But anyway, I try to learn about it because I like it.
See, it is very easy to understand acupuncture. Is very easy. Tongue acupuncture is the easiest acupuncture in the world.
Yeah, yeah.
Tongue acupuncture, you must know about the point. Write down the number of the point. Go to YouTube, see the point.
Yeah,
Put the needle, topic over. Put the needle, topic over. But then the problem is what? You know, the problem is the diagnosis of the patient.
Yes, sure. First, we have to know the cause and the effect. Then we have to diagnose the part.
Yes.
Then we have to know that we should know that
See, now what?
a certain
See,
point
now,
to put needle.
Yes, correct. Yeah. Now what happens in our group? This for them, everything is depression, right?
Yes.
In our people, if you ask them, most of our students, if you ask them about psychiatry, for them everything is depression.
Yes.
Or anxiety.
Anxiety,
Yeah.
yes. Anxiety and
They know
depression.
2 words. They only know 2 words. Say he's having depression. But when you classify the patient, then comes the what?
Yeah, we have
Paranoid
to.
disorders, bipolar disorders, this, right?
All
Now,
those effect and also
yes,
diagnosis.
yeah, clinical. Now, to arrive that the person is suffering from a particular disease, there is a procedure setup, right?
Yep.
This procedure setup, no one knows here.
Mm-hmm.
The problem with the senior doctors is that they have forgotten the procedure setup. The junior, these people, they don't know it because no one taught them. So, seniors have forgotten, juniors don't know. What will the patient do? And that is why we see 80% of the people, they do not recover in the society. They go from one place to other place, one place to other place, and somehow they recover. Because they do not know in which case they need to put TheraBand exercise, in which case they need to do some isometric. They do not know where is the shoulder weakness, where they have to do NIBS. Nothing, they know nothing. Because they don't know what is a disease. So if
The
you
most
don't know
important
disease,
is,
when you
yeah,
are
we
not
have to know the
confident.
disease, right? That's correct.
Say for example, you are a PhD in psychology. If you do not know the procedure of diagnosing a patient of particular psychiatry, for example, if you study the Korchin of clinical psychology book of Korchin, in which what was mentioned, it has been clearly mentioned in the page number 72, I suppose, third paragraph. What was it mentioned? The mention was that a patient before declaring a disease, a person, a physician before declaring a disease, a set of procedure has been set up. A set of procedure being set up to diagnose the disease, and then having confirmation and positivity in all the symptoms mentioned about the disease, and then the clinical investigations plus pathological and radiological investigations. And when all these things are clear, then you can clear that the patient is suffering from a particular disease. But here what happened? We take a data, we take a complaint, and we convert it to a disease. So now we can understand what is the condition of the society. How society will grow, how society will understand, all is a big question. That is why I say people are worried about money. They are not worried about recovery. They go with a weighing balance, sister. They go with a weighing balance. How much money I put and how much I will get. Knowledge is not measurable. If your concepts are clear, you understand things in 2 minutes. And if your concepts are not clear, you keep years after years and you understand nothing. You have to understand what you need to understand. Anyway, any more questions for today? Questions, please. Arvind, can you speak to me? Arvind? Filipino Arvind. C112, can you speak? Any young boys out here? Any young boy? In between 20 to 35, anyone here? No. See, one thing you must understand before I conclude my topic for today. Knowing what is the right disease. When you know all this properly, I took last time also classes, no one wrote down, no one revised. And today when I was supposed to teach you about the shoulder pain, different types of shoulder pain, what did you do? I had to repeat the class. I have no problem in repeating the class because this class is only for upgrading your knowledge. Some medical doctors were getting bored, but that is okay for us, no matter. They may also revise something. Can you hear me? Can you hear me?
Yes, sir.
Yes, sir.
Yes, sir.
Okay. I'll teach you, see what is the problem with our medical people. Let us go to Dan George. Filipino Dan George, can you come up with the mic?
Hello, sir.
Yeah. Can I see your face?
I can't say I'm having a problem with my phone. Only the audio is available at the moment.
Okay, it's okay for us.
Oh, okay, thank you, sir.
I have one question for you.
Yes, sir.
For example, I want to teach you about paralysis, right?
Yes.
You came to me when few students are left in the room, okay?
Yes.
And then I tell you, okay, you open your shorts and shirts. No need to open your undergarments. Open your shorts and shirts. Now, what is the fear you have in your mind? 1 to 10.
Around 10.
See. Now you understand. Thank you so much.
Yes, sir.
Now you see that this is our condition. That even While learning, we have our fear of 10. How will we treat the patient? That is why I say teaching non-medicals is very, very difficult. You know why? Because your mindset is not ready to learn. You have a fear to learn something. I don't know. What will be your fear while treating a patient? Opening one shirt. I can open it right now. What is the problem? You see, I'm opening my shirt. What is my problem? Will I become an exhibitionist? No. That's what I said, all of you. It will take you a long time to become a physician. What I see, your status and your knowledge will take around 20 years for you to become a physician. Because your mindset is so weak. You are just afraid to open your shirt to learn about the muscles. And in physiotherapy, in the open seminars, these people, they open the clothes and they learn it. Your mindset only is weak. And I don't know where will you put the needle. I think you will put the needle on the clothes. Cindy, may I ask you one question? Cindy,
Yes, sir.
can I ask you one question?
Yes, sir, please.
See, if these people are afraid of opening your own shirt, then how will you open the shirt of the patient? And where will you put the needle? And how much fear you will have to put the needle? Where will you put the needle? Over the clothes, or we will open the clothes?
They have to open the clothes of the patient.
Yes. See? You have a fear of opening your own shirt. And your fear is 10 by 10. Then while treating the patient, your fear will be 10 by 20. And it is not you, everyone. How will you be a physician? Think for a while. For me, you are just a raw potato. Raw potato means I don't know what to do with you. Yes, I always come to the class because it is my duty to come in the class and take the class. But it is very difficult to make you a physician because you all have come from very, very difficult community. Your knowledge is very, very weak. A person who feels, I'm not saying about that person alone. I am saying about every one of you. If you feel shy to open your shirt and learn, how will you learn the medical science? How will you learn about the different muscles? How will you understand about the joints? That is why I say, I think some of you people have wrongly selected medical science. They think medical science is the most serious subject. I think some people should, not one or two people, I'm saying some people, they should choose some other part of the science if they are not serious. And if they are serious, please study seriously. This studies what you are doing is of no use because you are not at all serious. Think over it. We do not know about the shoulder joint. Various pathologies of shoulder joint. We do not know how long it takes to recover in a normal line of physiotherapy and medications. How long it takes to recover a shoulder pain. And then you see, you come and put a pressure on me when I go to your seminar to recover a paralysis patient. In 3 minutes, you tell what kind of doctors can I expect from you and what can I teach. I have recovered him. Then what? You want to repeat the same result. And if you don't get the result, you say I am a black magician. Rather, I laugh at you and I say, oh God, when they will be matured enough to know the anatomy and physiology of the brain. Very difficult to teach you people. It's easy to teach a high secondary student, but it's very difficult to teach a matured person. Even God cannot teach, because Jesus told people, don't do this, don't do this, don't do this, and everyone is doing the same thing. Jesus said, never do adultery, and here you are having one wife, 7 girlfriends. Yeah? I don't know. Why should I say? And then I'm asking you one question. Who will go to heaven? Do heaven belongs to us? I don't think so. It belongs to us. How can heaven belongs to all the type of wrong people? Even if we pray sincerely, it does not belong to us because we are wrong people. Praying never purifies your work. Praying never purifies your karmas. You do 200 murders and then you expect me to take you to heaven? Never. Until unless you do good activities sincerely, honestly, dedicatedly, nothing will come up. I'm really sorry to say that. We prayed Christ, but we never followed Christ. We prayed Buddha, but we never followed Buddha. If you have done your work sincerely, dedicatedly, with the knowledge, today you would have not been here in my class, you would have been taking a class. You still think frozen shoulder takes 3 months to recover, and I think 5 minutes to 7 minutes to recover by 70%. I'm 3 months advanced to you, or 6 months advanced to you. Not only 6 months. How many hours I'm advanced to you? You just put needle, 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 needle. Machine, needle, point. That much only you know. God bless you all.